Hot takes, real talk, real issues, you know the deal. We keep it fresh, we keep it true. On Mary with the Voice podcast.
Oluwabukola. Is it Oluwabukola?
Yes, Oluwabukola.
Yeah, I got it right.
You got it right.
We met at Luth Teaching Hospital.
Yes, we did.
When I was doing my internship, and we've stayed more or less friends since then.
Yes, we have.
I've always wanted to know, but couldn't really ask then or didn't remember, but now I want to know. How did you, knowing Nigeria, knowing Africa, our perception when it comes to mental health, psychiatry, mad, how did you get to being who you are, psychiatrist, as a young girl in Nigeria?
Funny, I never thought about it. But you asking, it was nothing to think about, really. Until I got to my university days, of course.
No. Where was primary school? Like
primary school
was normal. Where was it?
Primary school was. I lived most of my life in Ibadan, Oyo State. Mm-hmm. So primary school was Ibadan. One local area, Yimitu, if I can say, where was a Catholic primary school that I went to. So primary school was fine. Secondary school was Command Secondary School, Apata, Ibadan. And it was a boarding school. So I was a boarder then with my cousins. So that too was fine, even though I had extra pay. There's no way you will not do things that will make them to call you to the front of the old school. Then you know how it is that you want to do SSC in your SS2 class. You want to try JAM. You want to try WAEC. We're actually scaling the fence to go and do all of that. And of course, we were flogged in front of the whole school when we were caught. But well, that was that. And it still didn't make me feel like I didn't have a good life, a good experience in my secondary school.
So you did, you knew you had to be a doctor, or
yes.
That was, you said, the traditional.
The homes then, parents were helping to fill jam from, you were either a doctor, an engineer, a lawyer. So far you are doing science, you already know that, okay, if it's not medicine, it's pharmacy. If it's art. It is art, yes. If it's, yes, you're either a lawyer or an accountant. So that was...
So those were the selected for you?
So I knew it was medicine.
Okay.
Yes.
How do you know?
Because I was a science student. I was already in science classes. So medicine, I wanted medicine rather than the pharmacy. So it was either of the two, quite all right. But then medicine was just the go-to. Okay. And you won't believe it. I grew up with my uncle and auntie. He has 5 doctors to date. 5 doctors to date, including myself. So it was science. It was you just knew it was going to be medicine. Mm-hmm. It was just going to be medicine. Okay. So it was medicine for me. Mm-hmm. So entering the med school, the normal techniques say you need to read, you need to study. You are categorized as the EFICOs. So, but luckily, I had a year of degree. That's what they call like preliminary year before you enter the medicine itself. So I had friends outside of medicine. Okay. So it didn't put me in the boring class of just your friends are just the medicine people. So I had friends on other courses, other departments, So it wasn't so like, okay, all my friends only were medicine people. So during the years of the medicine, my training and all of that, it was the year we started psychiatry posting. That's, of course, I think for a very long time, I thought I was going to be a pediatrician. For a very long time, I thought, pediatrics, I like kids and all of that. I think babies. Yes, I think that won't be a bad idea to do pediatrics. But of course, as we were into the school doing all of that, when we now did psychiatry posting, We even we did a posting at Haru. Then we went to do attachment at Haru, Abeokuta then. So it was interesting to me to see that just merely listening to people, because practically there was no test to be done. Just merely listening to people, talking to you, you were able to diagnose that this is what is wrong with them. You are able to give them medication and they'll be fine. So it looks, this seems interesting. And of course, pardon me, it would give me room not to be the in category, the doctors that do the surgeries and all of that. And you still be referred to as doctor. But okay, you're like, won't people be thinking, psychiatry? In my language, you say, what did you go and find here? What are you looking for? Well, I said, well, it's an interesting place. If I didn't do medicine, honestly, maybe I would have done psychology. Because the fact that you just listen to people, you're able to help people. And
but don't forget, you were a science student, though.
Yes.
And it wasn't a traditional course. So
yes,
you couldn't have done psychology.
No, I wouldn't have. So it was just like, if I wasn't doing science courses, if it was some arts course, it would have been, maybe at some point, it would have been psychology. So they are just like listening to people, understanding that, okay, just listening to people, you can help them. So that was, I think at that moment I knew, I think it was psychiatry for me, not pediatrics anymore. I'm sorry.
And the family front was okay with it?
Yes, it was. My brother initially was like, no, Buki, you have to do pediatrics. And I was like, my interest has already shifted. Let me do psychiatry. It was like, well, if it's what you want to do and all of that. And he let it slide. And it was like, okay. All the best in it. It wasn't as if it didn't come with its challenges. I had my own challenges while in the training, but yeah, I am today.
What are the biggest challenges you've faced thus far being a psychiatrist?
Being a psychiatrist or doing the training?
No, being a psychiatrist now.
Okay. Well, one of it is when you find out that you have patients that, irrespective of how much you want to help, you are not able to help them. And this will be coupled with the fact that maybe there's no family support. The family is either that they don't understand what it is, or let me use the word abandonment. I will not give a name. I had this patient at some point. He had a medical condition coupled with the fact that he was also schizophrenic. But he lacks insight. You know, when people lack insight, they don't believe that they are healed. So the insight is even very poor. He spiritualized it because he was a clergyman and believed it was God talking to him, telling him all of not. So it was difficult to even treat him, to make him get treatment. But the relative, they were able to bring him to the hospital. But after bringing him to the hospital, after 1 or 2 visits, they abandoned him. Yes, they abandoned him. So treating him was difficult. Getting medication to help him get out of that state. Relatives were not forthcoming for payment. There's little the government can do while he was on the BS. We sought some drugs for some time. But of course, he's not the only patient in the facility. So it was difficult to get him out of that state. If he gets well, went on medication for some weeks, when he's off the medication, it's as if we are going back to the beginning again. So it was and this patient was registered under me. And I'm like, how is this patient going to get well? If there's no consistency in medicating him, we always preach support. Family support is the key to getting patients to be well. And I kid you not, this patient is still on my ward.
Sorry, what?
This patient is still on my ward.
After how many weeks?
More than 30 weeks.
Sorry, that's how many months?
I've gone on leave. I'm still on leave. And this patient is still on the ward.
Abandoned.
Well, we are doing the best we can.
Is the family support still there?
No. They have not come forward.
So what happens to a patient like that eventually?
Well, the patient like that, we get some NGOs, some private NGOs, private persons that want to help. They go through our social workers in the facility, and they seek that, okay, they want to help patients that cannot do this, do that, and they'll fund the treatment.
Mm-hmm.
But, you know, the stigma of psychiatry is another thing to talk about. Honestly, because most NGOs would rather fund patients of other department, other illnesses, maybe the ONG, the likes of the pediatrics, the babies. But psychiatry, because of the non-awareness, even though we are pushing the awareness, people are talking now, they believe it is self-inflicted. So they will say, why do they want to help patients that caused this on themselves?
Self-inflicted how?
Exactly. You know,
is it because maybe if drugs?
If it's exactly. That's where I want to go. Mm-hmm. If it's drug, they believe it's self-inflicted. They are the one that went to smoke, but they don't understand that there are some patients that, because they want to self-medicate,
they smoke.
They go to smoke. Maybe it's giving them some way they drink. They become addicted to alcohol.
So people don't understand that the smoking is actually to numb the main issue, the underlying issue. People don't see that these are symptoms of trying to cover an underlying issue.
Exactly. They don't see it that way. And those people doing that, it might be because of they don't want to be labeled, in quote, as crazy. So they will not come out to speak out that, okay, they are going through this. They want to seek help. They would rather now do it by covering and leading to taking substance, and not knowing that in itself can even lead to addiction, which is another psychiatric illness.
That's another one we get to. That's a whole different one we talk about.
On its own,
so
exactly.
Which ways and what substances within our culture now are people using to numb issues, numb their pain, numb their diseases? I mean, what do you want to call it?
Well, like I said earlier,
we have the alcohol.
We have the alcohol patient that are.
But which ones are the?
In quote, all of it is in the same category. It's in the same category of the addiction. We have the alcohol in the patient. Like let me say in men, commoner in men, that they don't want to come out and say maybe they are depressed. They have the heart of all the depressive symptoms is clearing. They have the low mood. They are socially withdrawn.
Because we're similar background, same background. At what point? Because people just say they're down for a week or two. I'm depressed. You know, clinically we have.
You just said it's clinically 2 weeks and above, and you are not able to do the things you do normally. You are incapacitated. You are not functioning. It is affecting your normal functioning. Mm-hmm. So there are areas of symptoms that will make you say, okay, this person is clinically depressed. Yes, you have the heart of the low mood. You have loss of interest in previously enjoyable activity, and you have the reduced energy. Those are the main clinical symptoms. But you now have other minor symptoms that can be associated with those symptoms. We have the poor concentration. We have the poor sleep. We have the feeling of hopelessness, feeling of worthlessness, even feeling guilty and the likes. Mm-hmm. Eating poorly, and also suicidal ideation. So all this together with the fact that the person is not able to go to work, the person is not doing the things they normally do after 2 weeks and above.
Only 2 though?
You said what?
Only 2?
Only
2 weeks, or
no? That's for that's for you to say, okay, that person is
wrong.
Something is definitely wrong. Depression. While the hours of the psychosis, like the schizophrenic illness, that one has to be for like 4 weeks, 1 month. The symptoms would have been there for like a month, and more, like that. So
wow.
That's when you know that, okay, something is definitely not sitting right well with this person and all of that, you need to seek a professional help.
So which other stuff would they use?
This person might not now be taking alcohol. Alcohol, some people, alcohol itself is like a depressant. Not knowing that they are worsening the symptoms.
How's alcohol depressant?
It is a depressant. It makes someone feel depressed. It makes that's how it works. It depends on how you use it.
I thought they said it's not what they call shayu.
No, it's a depressant itself.
No, so
that's how it.
They see it as you drink it numbs. It numbs.
So they sleep off their sorrow.
Yes, you're completely detached from reality
those
consciousness.
Are depressive symptoms itself on its own.
Be detached from reality, and
you want to be by yourself. You just want to be sleeping all day. You just want to you care less about what is happening around you and all of that. In using the normal language, just saying it out there like that.
But
that's alcohol. There are other substances.
So, but not the person that drinks in social environment, though. Or could they still be functioning depressed
if you
people,
are functioning,
but they're drinking at social events? You can be depressed and still functioning.
If you are depressed,
clinical,
if you are depressed clinically and it is diagnosed that you are depressed clinically, you are not functioning. You feel you are functioning, you are not doing the things you're not meant to do. So, but if you are now depressed, there's, like I said, there's a mild and moderate and severe type of depression. So the mild kind of depression means that, okay, you have not gotten to the stage of medication, you have not gotten to the stage of, okay, you need to be admitted. You are just at the stage of, okay, I think something is wrong. You can talk to a therapist. That's where the psychologists come in. If at least when you are still able to talk to someone, that kind of person is still able to go to work. But of course, we'll know that something is just not sitting right well with the person. The symptoms I said earlier, the 3 symptoms, the low mood, the reduced energy, and the loss of enjoyable activity and all of that. Those symptoms will not be frank in that person. It might just be low mood that the person is having.
Okay.
You just understand that his mood just swing. Maybe in the morning, before the end of the day, it feels better. Maybe in the morning, it feels just the low mood, and maybe he's not sleeping well and all of that. But this person is still going to work. So that's the mild type. That person is still functioning, not really. So that you can say is the functioning depression, like you using your word. So that person just might need to talk to someone to help navigate whatever thing might be causing him or having that feeling, and the person can come out of it strong without having to get to the stage of moderate to severe that will be needing medication at some point. So aside that, there are other they use the marijuana.
How accessible are these substances? Sometimes I ask myself, how do they get it?
It's accessible. You are just not, because
within that space.
Yeah, exactly. It's everywhere. Honestly, it's everywhere. They get it easily these days. I don't even know what is happening now. Even our kids in school have access to all these hard drugs. Yes, you'll be shocked how many students they will refer for assessments because of testing positive to marijuana. All these private universities, I'm not saying any name, but yes, so these things are available. They are out there.
How does smoking marijuana affect the brain?
Of course, it affects the brain. It causes this.
Because people think it's just smoking. I'm just smoking it. Can we just touch a little bit, educate parents, maybe with young students or even adults, thinking I'm just smoking 1 or 2. How can that affect the brain?
Of course, it affects the brain. It's by you saying that the person, some people, it's even a puff that might send them to the hospital.
How so?
Just a puff, meaning the brain is not cut up to even withhold such. By the time they take a puff, you're now saying that they're hallucinating, they're talking out of point, they're restless, they're not able to sit still and all of that. I've witnessed just a puff bringing a patient to the emergency. The person starts talking irrelevantly, trying to strip himself. Yes, because it has gone to his brain. All these neurotransmitters, has been affected. And some people, they don't know that they actually took something. That's why cookies, cake, they can list them with those edibles now. They can list them with all these marijuana and all the likes. So those patients, persons like that can just develop irrational talking irrelevantly, wanting to strip themselves, talking out of point, saying that people are after them. They start hallucinating and all the likes of it. So they bring them to the hospital, and you'll be wondering that, is it just not one puff? The brain is different. My brain is different from your brain, how I will respond to something. But the truth of the matter is, anybody, me and you, anybody that has a brain is likely to have a mental illness. It just depends on how...
Your lifestyle.
Apart from the lifestyle, it depends on how your genetic thing is. There's also this genetic thing and all of that. Maybe you don't have a family, you don't have a genetic load and the likes of it. So imagine someone that already has a genetic undertone, that there's this family line, there's this family issue, that it's possible that you can have a mental illness
So stigma, quote, they have madness in their family.
No, I didn't say that.
No, but that's the stigma to check. When you meet someone and you want to get married in our culture, they say go and find out if madness runs in their family. So it is true. Our forefathers knew these things.
Of course, they knew this thing, that these things happened. And like I said, is because there's a genetic cause, and there's also the environmental or the social cause, and there's the psychological cause. Right. So imagine someone that has a genetic, but is there. You don't know. So if you now subject yourself to going to smoke, it will push it out. Yes.
So that's where they say the gene is there dormant.
Yes.
You just went
to and
triggered it.
Triggered it, or going through some life events.
And your hormones change.
And you have a tendency of having this. Maybe you lose a loved one, you lost a job. The way you now handle it, or not knowing that there's this fact that you can have depression, and it can just boom, push it out.
So basically, people have to be aware that it's not every disease or illness that expresses itself physically that is the only one that you have. We have dormant genes in us that could express itself in so many other diseases.
Yes,
which can be triggered with our lifestyles.
Yes,
and
the things we do and what we expose ourselves to.
That's so true.
And we are talking about substance. We have this patient that are sickle cell, HBSS. They have pains.
Right.
They now start medicating on pentatoxin.
But that's pain. It's not their fault, though. They're in pain. What can they do?
Go to the hospital. Why self-medicate?
They don't have money to come to the hospital. You know how our pharmacists work here. People don't have money.
Are you trying to say they are justified to self-medicating?
I'm saying that
it's pain.
They don't have money, and pharmacies are open to sell drugs. They don't have money to come and see you, but they're in pain. What would you say to a family like that?
The long run, you are using the pain to relieve your pain, using the med to relieve your pain. Okay. And the pain subsides. There are other medication you can use to relieve your pain.
So one of the ones are certain pain medications different from others?
Yes, because this pentatoxin is addictive.
Okay.
They get this euphoric feeling by the time they start using it. So even if the pain is not there, because of them getting used to having that feeling that, the euphoric feeling, they feel good, they can they feel good when they take this thing. Irrespective of the pain, they want to use it because they can not help themselves. They have made their brain has rewired. I've gotten those
the high.
It has been wired that once you get this thing, this is how you feel, and you just want to have that feeling almost all the time.
It's an addiction.
That's an addiction.
So there are other meds that can be used that will not cause addiction to
yes, there are
pain.
There are other meds that can help with the pain, but like you said, pain is different from pain. But if you go to the hospital will help you, even if they might have to use any of those addicted, but they will give it to you in a regularized manner, not in a manner that you'll be addicted to. They will give it to you, wean it out, and the likes of it. And we do not give it for patients to take home. You get it in the hospital.
In doses.
In doses, exactly.
But then I've heard some of them say that the pain can be so much that they overdose. So you give them in doses, they will now overdose the doses you gave them just to ease the pain. So the dose finishes before it's meant to finish, and they'll come back.
The truth is, once you're addicted to something, your brain has been wired to the satisfaction you get when you take this thing. So they will justify their action that the pain is so much, even if the pain is not there. Addiction is you increase the dose of the thing you are using, irrespective of even having to affecting your lifestyle. You take primacy to the meds rather than whatever you're supposed to do, maybe your job and all of that. Like in the case of alcohol, you take it as an eye opener. First thing in the morning when you wake up, you're drinking it. Yes, first thing in the morning you're drinking it. It has to meet those criteria for you to know that you're addicted to something. The tolerance, the withdrawal symptoms when you're not taking it, feeling, having tremor, sweating excessively, you are not able to just get yourself to calm down.
I think people need to hear the tolerance. That before I could drink maybe a shot. And I would be feeling a bit woozy. Now I can drink 4 shots and I'm not feeling...
Exactly. Start increasing the dose and you get...
So people need to understand that you can become alcohol intolerant. Abi, what would you term it?
No,
tolerant.
No, those are some of the things you experience. Your tolerance level has increased. You start having withdrawal symptoms.
If you don't.
If you don't.
If the frequency.
If you have stopped taking it, so that will make you to go back to taking it. That will make you want to go back to it. You'll realize that if you are not using this substance, you don't feel good with yourself. You neglect your work. It's now you've taken it as a primary, what you want to do all the time. Neglecting your work, you're not even focusing on your job. You're focusing on this substance you're using.
Wait, so this sounds a bit extreme, but let me give a different scenario if that can still be termed addiction. So I'm not neglecting my work, but I have to take it every night before I sleep. See, it's controlled.
How controlled is it?
I didn't neglect my work. I still went to work, but I have to take it before I sleep. So they're controlling when to take it so that doesn't impair their work.
Is that what you were told? Or is that what that person...
I want somebody listening to hear at what point really is this an addiction. If I choose to drink it at a certain time every day, rather than it affecting my work hours every day, is this still an addiction? Because they can say, well, I drink it at night before I sleep. Do you know what I mean?
They are medicating with it.
Okay.
He's medicating with it in that he's using it to sleep.
Okay.
Why not seek professional help that I am not sleeping, let them give you what you can use to sleep? It will get, of course, you will get to a point that it will not now work. are you going to increase the dose you are taking?
Definitely.
So it will increase to the dose you are using is increasing. You have to take more than the number of things you are using for you to kick in.
Yes, for you to have that effect you are seeking.
For you to have that effect, that means you are increasing your concentration of whatever you are taking, and that you are self-medicating. Then, so like I said earlier, addiction, you have to meet the criteria for you to say that okay, you are addicted to substance. Primacy, taking it as irrespective of your job, you are taking it, and this person that you give me a scenario that okay, is not affecting you, the person will feel is not affecting because he's sleeping and he's still only taking it. How can you be? He will not tell you that during the day there are no times that maybe
think about it.
No, there are no times that maybe like blank out. You just like okay, they are not just focusing.
Also, the other symptoms that they experience during the day.
Subtle symptoms. Okay. Maybe, of course, there's some, and there's no way that maybe in the morning you might not just say, okay, let me quickly take a shot. I hope now. When people start calling them alcohol, they get angry that maybe you're drinking, they get angry, they get defensive, they can take offense and all of that. And you are saying you don't have a problem. You don't have a problem with it.
So which other substances do people use to numb their pain and issues? Aside from the alcohol, the marijuana, and which ones are we facing in our society?
The marijuana is everywhere and is different types. They have numerous names for them that I cannot even. Even, yes, the different types, the ones they list, the one that is not list, the Colorados, the Ghana High, Sorry, did you say, no offense here, Ghana High? Sorry, did you say Ghana High? It's the name of my type of marijuana. I'm not the one that named it now. And even
so they have a marijuana called Ghana High.
The funniest thing is even the meth that we just read in book, meth is out there. And that one even causes hallucinatory experiences easily. The like of the meds, the like of the... there's this thing that is not even so common for stimulants. Patient that wants to take stimulant, they come and tell you that they will diagnose themselves of having OCD, having ADHD. Sorry about that, ADHD. They will tell you, doctor, I have ADHD. You know what you use to treat ADHD is stimulants. Because they want you to prescribe stimulant for them. Oh,
no way.
Yes.
So you didn't diagnose them. They will come and self-diagnose.
They will come and tell you I have ADHD.
And they'll tell you the symptoms.
They will tell you symptoms. But of course, there's no way you will catch it that it is not. You know, with your experience, with your clinical experience, you ask that question that even though they've read it, you will still tease it out that they do not have this thing. It's because they want to get this medication to help them still feel that feeling of highness with the stimulants, but they want it to be prescribed now.
How do you help a child with ADHD? Since you just touched on ADHD, okay. So adult comes trying to get free meds.
Yeah.
Now you have a child. A parent has read up on the symptoms, possibly on the net, and the child has at least 5 or 4 of the symptoms of ADHD. How can they help?
Seeking help by going to see the specialist. We have called psychiatrists that are child psychiatrists themselves.
Okay.
I'm of the general adult psychiatrists. So we have specialists that are child psychiatrists that they can be referred to, they can see. And what do they need? They need to have an assessment. Let it be known that okay, this is what they really have. Mm-hmm. There's medication for it. They monitor, but there's a particular age you can start that medication. Oh. So you need to go and seek professional help and not just stay home and be telling yourself that this phase too shall pass.
It's just now that psychology, mental health has, received a bit of attention.
But you're not even saying the common disorders, that the likes of the anxieties, the likes of the anxiety, the likes of the depression itself,
Okay.
the like of the insomnia itself.
Okay, so let's
Those
round
are
up on the ADHDs, and ADDs, and then we'll go into those ones.
Those are even common out there, and you realize that you're not seeking proper help because of, in quotes, the stigma. You don't want to be labeled, but this thing happens. Stressors. There are stressors. The country itself is a stressor to people. The economic crisis and all the likes is a stressor. So businesses are not moving the way they are supposed to move. You now realize that you are worried. You are having less sleepless nights. And sleep is a very key factor in our life. They preach that at least between 6 to 8 hours of sleep, and to just make it in quotes, laugh it out, like, okay, if you are someone that is productive and you are making it at least 6 hours of sleep, if you are sleeping more than 6 hours, I'm not sure what you are doing. But the normal sleep we say is between 6 to 8 hours. Have at least 6 to 8 hours of sleep at night for your brain to function well. So if you are not sleeping well, you're already thinking, you're worried about your business, the stress of the company. We wake up in the morning, you enter the traffic, the place you're supposed to get to within 30 minutes, you're getting there like 1.5 hours or plus. You'll be frustrated. You just realize that you're just getting angry, you're snapping at people when you get to work. You'll be wondering what is happening to this person. But this person did not sleep well. Don't forget, the person did not sleep well at night. The person started going to work, enter traffic, maybe you even had to go and queue for something. Just life just happened. The person just gets to work. You now be wondering, this person is just snapping. So that's why you say you don't know where the person is coming from. Just be nice to people. You don't have to take out you don't have to reciprocate whatever the energy someone brings at you, because you don't know where that person is coming. So the person might be suffering from insomnia. Insomnia itself is just sleep problem. And it's now so common that you just realize that people will come to you, doctor, I'm not sleeping. Doctor, I'm not sleeping. And you try to tease out that if it's not part of a depressive symptoms. Yes, because insomnia can be part of a depressive symptoms in a patient. But if you now find out that it's just insomnia, the person is actually not depressed, and you'll be wondering what is causing this insomnia. Of course, stress itself can cause insomnia. So this person will have to see a psychiatrist to be treated for insomnia.
How would you do that? Medications?
We also medicate people to help with their sleep. So that's what I'm trying to say, that it's not only the schizophrenia-like illnesses that you see a psychiatrist for. So
that's what the perception is.
Yes,
it has to be
the extremes of the schizophrenia, the ones that are already hallucinating.
Yes, the extremes. Like that's when I see a psychiatrist.
Yes, there's this one that we even call the bipolar, having mania, being bipolar, being manic, and all of that. All this is the psychiatrist you still see. Yeah. The simplest one is anxiety. Everybody has a form of anxiety.
Right, it's just life.
It's life, but it becomes a problem when it is affecting your functioning, like I said earlier.
Right.
Anything that affects you from functioning well becomes a problem. And if it is persistent and it is ongoing for more than the duration of time. So you have to seek help. So that's where the psychiatrists and the psychologists come in play. Yeah. Because we usually preach that it's not only medication. If you see your therapist as well, and hand in hand in a psychological intervention and a medication, they help patients holistically to become to improve their states. You are the psychologist, now you do this cognitive behavioral therapy thing, and while the doctor is medicating, you are helping the person to help navigate maybe having some distorted thinking that is even affecting the cognition, helping. So all of this, it works hand in hand to help the patient to come out of the states they are in. So it's not only when you are talking to yourself, you're hearing voices, you're seeing strange things, that you come to see the psychiatrist. Psychiatrists will also help you if you're having the simplest of the things, the sleep problem. You're not sleeping well. It is us that you still come and see.
It's not the primary. It's not the primary.
The physician. Physician also referred them to the psychiatrist. Insomnia is a psychiatric illness.
Okay.
Yes.
See, that's a problem. Psychiatric illness. That's where the stigma starts.
So we are using more of a mental health, wellness thing, emotional wellness, emotional illness.
Okay,
we are using more of those words now.
Yeah,
for
so that
patients
people
to be more
dilute the stigma.
Yes, for people to be comfortable saying, okay, I want to go and see a mental health
practitioner.
Person. But you cannot just take away the word. We are still psychiatrists, I'm sorry to say. Yes, you can still, because somebody can be on the online and refer him or herself to a mental health practitioner. What does that person have? It might just be training in something and is preaching. So let us spell it out. I'm a psychiatrist. It's fine. Right. And that's the mental.
I'm not a motivational coach. I'm not all this
everywhere thing. Yes, we are psychiatrists. That is our term. But we deal with mental health issues.
Right.
So you come to us. So what I'm trying to say is that it's not only when the likes of the hallucinatory things come in place, that's the only time you see.
Yeah, so can you just give us a range of the normal issues that people could seek a psychiatrist for?
Apart from the depression, from the...
Give us like a range of, like you said, sleep. Yes. You were even saying if sleep, I didn't even know that
there's also this thing, maybe post-traumatic stress disorder.
No way.
Yes, it's us too. You come to see, maybe something happened, there's war, there's...
PTSD.
Yes, you come to the psychiatrist to help you navigate through that state. Not any other person. There's so that's that.
So we have the post PTSD, post traumatic stress disorders. We have the post delivery.
The that's purpurium psychosis. It can be
We have which ones again? The basic ones. Bipolars.
I said yes. The bipolars. We can be the manic one.
Anxiety.
It can be,
you mentioned anxiety.
Yes, anxiety. Everybody has a form of anxiety in us. You have to have an anxiety, some form of anxiety to go for an exam. But it becomes a problem when you cannot even sit down to do that exam. That is when it is now a problem. Of course, you can have anxiety to function well, but it becomes a problem when you can't even do the exam. You cannot do this. You have to seek help. Yeah. We have the insomnia, like I've said. We have the substance abuse itself. We have the...
At what point do you seek help with substance abuse?
At what point?
When
it becomes a problem.
You're saying, people are saying, no, I'm managing it. I don't have a problem. I know what I'm doing.
Those ones are in denial now.
So at what point now, as a family member, do we report or do
when
we
the family member starts saying that this person is not doing things the way they are supposed to do? Let's not even go into the ones that are having hallucinatory experiences. Let's leave it at that. Somebody that's okay. Instead of you to go to work, you prefer to be taking substance. It will show in your functionality. You are not doing what you are supposed to do. You are at work, they are complaining about your work. You are not delivering. You are not doing the things you are supposed to, because you're already thinking of you want to be high. You want to have that elation. You are not concentrating at work. When the family members say that, okay, this person, you will not even, you will not be going to work. You'll not be going to work. Now push that the person is not talking out of point. The person is not even making, you are saying A, the person is saying B. The conversation is not, it's not coherent. It's not making any sense with whatever the conversations you're having.
Yeah.
The person will neglect their care.
The self-care.
The self-care. You notice one or two things. The person is not taking self-care. We just said, I'm not going out now. Why do I have to take my bath? That's where it will start from.
Ooh.
I'm not going out now. Must I take my bath? I'm not going out. Before they start the oozing and all the likes of it. So, when you want to even know that, okay, a friend, a colleague, or someone is going through a hard time, somebody that is a bubbling person before is always out there. You now notice that this person is quiet, is not talking as much as he or she would normally do. This person would just come to work, and leave. Don't wait for that person to break down before you talk to such person. That's how you notice that maybe something is actually going on with this person. It's just
what if they say nothing is wrong?
A little, how are you doing? Are you okay? You normally used to do this. Are you sure everything is okay? Just, you don't know what will break that person.
Right. What you say that would
just make the person to break down and will talk. And you help the person to seek the professional help that he or she needs. So I will encourage that when you see people that you know that they are lively, they are your friends that you have not even heard from in a while, you are wondering, don't just assume that person is busy. A phone call. I've not seen you in a while. Are you sure? Is everything okay by you? Just checking up on you. Check up on people. You might not know, you might be surprised what that person is going through.
What if I do the checkup and they say they're fine? That's what they will say.
But you did do the checkup, so that in the future, if you now hear that this person breaks down, you won't feel bad with yourself. That actually I did reach out. If the person says I'm okay today, you still feel 3 or 4 weeks, you've not still heard from them, still make a call. You don't know when that person will be able to break down and speak.
How do family members recognize their child or teenage child or uni child is using substance in any substance? How can the parents identify behavior? What can they look out for?
Well, that's a tough one because
it's happening.
But the reason why I said that's a tough one is it depends on what substance they are using, and it depends on how the parents are, their relationship with their kids. Mm-hmm. Are they very, these days you say parents, they go to work, they don't have time for their children, they just believe it's money, at least it's available, maybe it's the nanny that is taking care of the kids. So how observant are they? How, when they notice a change in their child, how are they easy to pick it up? So it depends on the relationship they have with their kids. So if you know your child normally would do A, B this way, and you start observing that, okay, this thing is not sitting right. My child is not doing this. Maybe my child is keeping it to herself now. She's not even leaving her room, or he's not leaving his room. You'd rather be in his room. You're wondering what is happening. Try to talk to this child. It might not even be substance that the child is using. It might be that the child is also going through some emotional illness. It might be bullying in school. Mm-hmm. It might be maybe when teenagers are growing up, there are a lot of different things that are happening in their life. It might be low self-esteem. Mm-hmm. It might be anything. Just talk. Learn to talk with your child. So don't think everything has to do with substance. It might also be that they are going through some form of emotional issue that is affecting them, is affecting their academic. So you will know that something is wrong with your child. When the your academic performances drops, when your child is getting angry, you pick all those subtle things. And all these disorders, the likes of depression, they are not so classic in kids. It's not the traditional low mood. It might be that the child is very irritable. Do you get? It might be that the child is very irritable instead of the normal low mood that you see you are seeing in a child. It might be that the child is even sleeping too much. It might be you just have to understand, know your child and know that, okay, something is actually not sitting right, and seek help. Try to talk to your child. And the child will say, "Mommy, everything is fine."
Right.
Yeah.
I was going to get to that and ask you, at what point is it okay as a parent to bundle the child? Because we've had that experience at work a few times where they bundle the child and bring the child to
the hospital.
At what point is it okay to say, no, your answers is not okay, we just bundle you and go? At what point do you think it's necessary to do that? I
just said it. You must know your child.
Okay.
If your child is not behaving the way he or she normally would,
they're giving me the answers. I'm okay. I'm fine. They're not really forthcoming, talking. I remember there was a case before I left once. A young man that was an age mate to my daughter. I will never forget his case. And he was the same birthday as my daughter. I almost made it a personal thing to talk to him to see if he could open up. And as at the time I left, we didn't know if he had used substance, what was happening. But he had admission to go to med school. And he was brought into the psychiatry. And he was missing out on accepting the med school offer. And the parents were trying to get him to be well quick to accept the offer before he lost the admission.
What did they
He never
observe in
spoke.
him?
He wasn't talking.
He wasn't talking.
But that's why they brought him.
That's one symptom now.
He wasn't. So they brought him from school.
Mutism. Yes,
he wasn't talking.
He was just not talking.
He refused to speak up what he took, what happened. He wasn't talking.
What he took or none. You are drug screening now. Mm-hmm. You do the drug screen, and if you see this, you would see a positive result if there is substance in the patient's system.
Yeah.
Except if it is those ones that easily, maybe within 72 hours or 24 hours,
it's left the system.
But
the effect now is there.
Is there. So that's what I'm trying to say, that they notice is not talking. That's a problem.
So that's already a problem.
That's already a problem. It's not talking. So they say maybe professional will know how to make him talk, get him out to say whatever is bothering him.
Right.
So you must know your child. Learn to talk to your child. Be observant. Be there for your kids. When you see changes, you will see it. No matter how little, parents are that sensitive. If you are in your child's life, you will notice. You will. There's no way you will not notice that this my child is not something is really wrong. Let me talk to you. You do, and if it's not forthcoming, you're not getting any information. You say, I'm going to take you to a professional. Maybe if you talk to somebody outside of the house, maybe you come out and say what exactly is wrong with you. That is the people that understand that mental illness is not just the schizophrenia, the hearing voices or seeing strange things.
Yeah.
It is also the fact that there are changes in your child. It's not all medication. It might just mean that the child needs to talk to someone.
Yeah.
Yes, it might just mean that the child needs to have some therapy session. It might be something he or she is going through in school. So by the time and maybe she feels or he feels that if you tell the parent, they will not understand. And there's no how. They will act it out. So be aware that if you are not able to talk to your child, you are not able to get information out of your child, there are professionals that can help you to do that. Seek professional help and not label it that your child is mad. That's why you're taking the child to the hospital.
Or to church.
Oh, that one.
Or to church.
Church.
The culture we're in.
Spirituality.
They'll go to church
and
first
yes.
before they come. If at all they come to you.
If at all they come to us. So that's why the advocacy, the talking about mental health issues, letting people know that, okay, it's not only about this, it's not only about when you take substance, it's not only about that. So the clergymen themselves, they are aware, and when they bring their child to them and the mother or the father is complaining about this, they are able to tell them that, have you seek medical help? because they themselves, they are aware of, okay, have you seen medical help? Of course, I cannot tell you not to pray about something, but seek help first. Prayer and medication, they will both work. This one is doing his own. I will not say I'll take away your religion, your belief, because I want you to only seek medical help. No. Your belief is your belief. I cannot take that away from you. Our culture itself, we are easy to say, yeah, is their forefather something that is doing somebody. I will not, we say it. But I will let you understand that if your symptoms that you are saying, if you tell me, and I can tell you categorically that just see a professional help. And I'm not saying don't do away with your religion. No, I won't do that. I just say go and seek a professional help. Let the professional doctors tell you what they believe is wrong, and go ahead with the treatment and believe you or me. It's even the same God that you are talking to that will tell, let this medication work on my child. That is what I preach. There are people that take this medication and they still don't get well. They still don't get well. So if your child is taking it and is getting well, it is still God.
Testimony.
It is still God. So I will not take your religion away from you.
Because people don't understand that sometimes the meds don't work.
Yeah.
Some people don't understand that you have to change. Remember, we need to change doses.
You will change the type of drug, change until you're able to.
Because many times you have to change drugs for effectiveness.
Yes.
Try something. People don't understand that you have to try different drugs sometimes to get the right combination.
Like, exactly. It's because you understand. That's why you're talking like this. So, but that is it. If you go to the hospital, ask questions. Ask question. You have a right to know these things. Ask your doctor. What if I take this? What reaction will I have? What if this does not work? What will happen to me? Ask question. It's your right to know. And then taking a medication
to prevent side effects.
Yes, but don't forget that some people, because of a lack of insight, they will not be compliant with medication. So that's another story for another day. Compliance is another thing. So somebody that is not compliant, the family member will say the medication is not working now.
We had a patient that wasn't necessarily even non-compliant. The psychiatrist reduced the doses of the meds for 2 weeks. They relapsed. It took them 2 years to recover.
Oh my God.
2 years to recover from that 2 weeks reduction in dose.
Wow.
People don't understand the importance that you're saying of staying on your meds. Thinking I can self-regulate when to take, how to take it, and the intervals.
Leave that to your doctor to tell you.
How we've seen several reports, research findings, and things like that suggest that men are more prone to committing suicide than women.
Talking about suicide self, the government is even they are currently working on criminalizing suicide.
I was going to get there.
Now,
how reasonable is that?
They now want to let people be aware that it's not a crime to commit suicide. It's an illness. So instead of taking them to prison, take them to the hospital.
No, my question
to get help.
Coming to Nigeria and hearing suicide was a crime.
The government is currently working on that, so I think that will change.
How do you make suicide a crime? So if I didn't succeed in...
It's ignorance, like I said. People don't know. Now they are aware and they're working on it.
So as that we speak now, it's still a crime? No?
They're working on it not to make it a crime.
No, that's what I'm saying. As we speak now, it's still a crime.
They are working on the trajectory.
Yes,
how to make it known that now it is not a crime.
So if you don't succeed, you will not be jailed?
No, you go to the hospital for help. For treatment.
So do we have any research finding as to why men are more quicker to suicide ideation?
Yeah, studies have shown that suicide is commoner in men. Even I think it's like 3 times more in men than in female that commit suicide. Females, we know how to go to the hospital. We do know how to go to the hospital. Even for the slightest of the, we will go to the hospital.
Have you seen cases where they use sex to cope?
I've not had patients that has come to me that are using sex to cope. No. But there's no, I can't say, never say never. Yes. What is common is using substance to cope. Using alcohol, especially to cope. Using marijuana to cope. And the likes.
What was your personal experience with stigma in our field?
Even my colleagues stigmatize psychiatrists.
Sorry, what?
Even colleagues stigmatize psychiatrists.
Within the same hospital? Sorry, how? Oh. I remember there were a few.
They'll just say, they are psychiatrists. When you behave in some kind of way, they'll say, they're already behaving like their patients. You must not do anything. They're already behaving like that. They believe that we are not okay. But I'm very okay, as you can see. We are very okay. They believe that we psychiatrists, we cannot categorize ourselves as doctor. When your colleague say, psychiatrist, please, I'll speak my language. If you want to learn those ones, they're a word of their own. No. But really, stigma is there. When colleagues are stigmatizing us, now talk about the patients, how they feel stigmatized, even coming to seek help. So, but culture, the society, the environment is what is making the stigmas to stay. But because of the advocacy, people are speaking out more. People are saying, take care of your mental health. There's no health without mental health. People are talking about mental health now more than before. So people understand better. So I want to believe that this stigmatization is still there. But I believe with time, we are working on it with advocacy, it will reduce. I'm not bothered if my colleagues say, she's a psychiatrist, that's why she's behaving some kind of way. They are also not okay. So everybody has one nut.
Okay.
We are one nut that is not really tight. That's just joking.
Yeah.
Anyways, so the truth of the matter is, psychiatrists take care of patients doesn't mean we go through. We are also not well because we are taking care of the unwell. No, it doesn't work like that. Fine, our patient burdens us with all what they are going through and all of that. Of course, we are in our feelings. We are humans too now.
Yes, we're emotional beings.
We have to have empathy. We feel them. We understand that, okay, this thing, they're actually going through it. You show empathy and it will tell on you that, right. Okay, I feel this person, I feel you and all of that. So the truth of the matter is stigma is there, but with the awareness, with the advocacy that mental health, there's no health without mental health. Seek help when you are feeling this kind of way. It is not in quotes that you are crazy. That is why you are seeking help.
You don't have to be. It could be just even sleep issue.
Like we said earlier, just seek professional help when you need it. And I believe everybody will be fine.
The quote, many are mad, few are roaming. What's your take on that?
Many are mad, few are roaming. I will handle like anybody with a brain can have a mental illness. That's the way I will handle it.
Okay.
I'm not talking to many are mad,
few are
roaming. Anybody with a brain can have a mental illness. At some point, just take care of your mental health. Seek help when you need to.
Where can people find you for help if they need to contact you?
Oh, okay. I currently work. I'm a consultant in Lagos University Teaching Hospital. That's where
So they'll find you in the psychiatry
the
department.
psychiatry department.
Asking for
at
Dr.
Quadri, Oluwabukola.
Okay.
Thank you.
Thank you so much for indulging us. Thank you. Allow me to bother you with all the questions I have answers to, but we need to get it from you.
Yes, thank you for having me on board. It was nice being here, and thank you for having me as well.
Thank you.
I had a sore time.
Oh, did you? Girl, stop lying. This is Mary with the Voice podcast, healing souls one story at a time.